Coming up on this episode of Common Denominator.
You have to learn to live next to your pain. And that positive mindset of living next to it so you can walk together so it doesn't affect you in the way that you're attached to it. That's how you get through it.
This is Common Denominator, straight-up conversations with Moshe Popak. Relying on critical thinking and open-spirited debate, we invite you to find common ground on everyday issues and encourage you to be bold, to be optimistic, and to take action. To learn more, head to moshepopak.com, and we'd be so grateful if you'd like, share, and subscribe to the show. Now, here's your host, Moshe Popak.
Hi, everybody, and welcome to the show. Today, an esteemed medical doctor on new ways to treat chronic disease, plus what his experience as a coroner has taught him about life. But first, we'll be giving away another Common Denominator gift pack to a lucky listener that includes merch, mugs, and much more. Later in this episode, I'll share a password. To be entered to win, follow me on Instagram, Twitter, and TikTok at mpopak. And DM me that password on any of those platforms. Dr. Ira Price has expertise in emergency medicine, chronic pain management, sports medicine, and much more. He'll share exciting and innovative new ways to treat disease and manage pain, and open up about his work as a coroner. Dr. Price, it's great to see you, and welcome to Common Denominator.
Thanks so much for having me.
What excites you the most about medicine and pain management?
You know, that's funny. It's an interesting question because what excites me are the possibilities. When I look at medicine in general, I don't actually look at it as here's a treatment, here's a disease, or here's a disease and here's a treatment. This linear model of medicine that traditionally we've been doing for the last 100 or 200 years is really what brought me into medicine, but isn't what I'm finding is exciting for me. The exciting part is recognizing that disease or illness is far more than the absence of disease. And medicine is a world in itself. Medicine is like, let's say, the forest, and you have so many areas and there's so much creation and there's so many ways to create within medicine itself that you're not just stuck and confined to one area. That's what brought me in, and that's what excites me about medicine.
So in other words, you went through the traditional medical school process and you got your MD and began the journey as a classic medical doctor. I assume.
There's nothing traditional about how I got there and what I did. They're like nothing, zero. I wish it was traditional. I wish I had a boring life and could say, yes, I went to high school, I went to university, I went to med school and became a traditional doctor. None of that happened that way. I dropped out of high school. I was working in a gym, applied to one medical school, went Western medicine, but it was a really awesome medical school, McMaster in Hamilton, Ontario, an amazing school where we don't do traditional learning. We don't sit in lectures. We got to learn in small groups. So you learn how to think, you learn how to learn. And then I got my MD and I did 5 years of residency in emergency medicine and a fellowship in sports medicine, and then got into chronic pain management because our toolbox for the treatment of disease or the treatment of pain, I describe it as, you're trying to build a house and they give you one nail, you've given one nail and a screwdriver. And so you're using the back of the screwdriver to pound in the nail. Eventually it'll get there, but it's going to suck along the way. That's how we treat pain for so long. So I was frustrated, and that's what brought me into the whole thing. But yes, nothing was traditional about what I did, but I did practice, and I do still practice traditional medicine. Or when we say traditional, we have to define it, Western medicine.
So the typical framework from, again, as a layperson, I look at it as, okay, so the traditional way medicine, as it's taught in medical school, there's different specialties. But it seems like through the journey of looking at Eastern and Western medicine, I guess the key difference, just so we can explain to the listeners, it seems like Eastern is more holistic, looking at, okay, dialing it back, why did this happen? Instead of, okay, there's this issue. Let me give you a pill, or let me deal with this specific thing right here. Is that kind of your space where you were seeing that the traditional way wasn't necessarily working for you as a person out of the box?
Well, the way that so yes, but and for the majority of mainstream Western practitioners, I would say one disease, one treatment, or I would say one disease, 10 treatments to try to treat one disease. And that was somewhat of my issue. Whereas the school that I went to and the new thought of, not even new thought, the way that medicine should be practiced, and even according to, now thought within medicine, is that medicine is a holistic approach, and you have to treat the biopsychosocial. You cannot just treat one part, but we get so focused in medicine, and rightfully so for some reasons. You have a disease, somebody wants to be fixed. Give me a pill, I have diabetes, right? So that's what we think. We don't think about treating the underlying causes of these things. And so, yes, I come at it as an approach that disease or illness is more than the absence of disease, and you have to treat all of these things in order to treat a whole person, because we are a whole person. We are the combination of billions of molecules. We're a universe in ourselves, right?
Correct.
And so we are the world. The same way the world contains everything, we contain everything, and it's all interaction, and it all interacts. So we have to hit the basis and the bottom, not just the top of the disease. Yeah.
So when
that makes sense.
No, it makes complete sense. So I want to dial it to like a practical scenario. So a patient comes in, chronic pain. What would be your logistical steps? When you have this new patient that comes in to see you?
It's like the traditional way. When you came in, this patient has already seen 5 other people until they end up getting to see you as a physician, and they're expecting a magic bullet. Medicine expects, and it's not even medicine, it's people that expect a magic bullet. People, I keep going back to this, but people, and I hate to make this generalization, but it's the truth. People rather wait till they have diabetes or have pain and take a pill for it than try to treat it before it happens. So people come in here and they'll have, let's say chronic pain, and they've tried a couple things, and they want me to put an injection into them and give them a steroid injection into the place of pain, or an anesthetic into the pain, and give them a mind numbing and a pain numbing medicine, where I'll look at it and say, well, what are we doing for the rest of you? Are you doing your meditation? Are you eating well? Are you you do those things? Let's get you into a positive mind frame, and then we'll start talking about all the other things. And so I think mindfulness is all part of it. So it's going to be a holistic approach. And I know we say holistic, but this is the term we need to be the bridge, basically, between Eastern and Western medicine. And that's basically what I tried to do.
It seems more and more we're leaning towards that way. From your time practicing, do you find results, better results with, I guess, kind of holistic Eastern medicine, or I'm talking about actual practical results, or better results from conventional medicine, which seems to be, like you said, here's a pill, here's a drug, here's something. Which way, in the long term for that patient, which way works better?
It's hard to say. First of all, we have to define what is Eastern medicine.
Right.
Does traditional Chinese acupuncture work? Absolutely, it works. And we've proven that. I think what we really need to get down to is, what is the scientific method? And does the scientific method work? Can you apply scientific principles and evidence-based principles to both Eastern and Western medicine? And I think you can. And I think you can, and that's where the bridge is. You can take, and that's actually what New Era does. That's the whole point of what I've done, and what we're trying to do within, the ecosystem that I'm living in, is we're trying to bridge the gap between Eastern and Western medicine by bringing that rigorous scientific protocol that's expected, and now we've evolved to come to expect of Western medicine should be applied to Eastern medicine as well. And so we can do that. We just have to apply the principles. The problem is finding funding and all that kind of stuff to do it, because it's not as sexy as here's a $3 trillion pill.
If you're just joining us, today we're talking with Dr. Ira Price about new ways to treat chronic disease. Earlier in the show, I mentioned we're giving away a common denominator prize pack to a lucky listener that includes merch, mugs, and much more. For your chance to win, follow me on Instagram, Twitter, and TikTok at mpopak, and DM me today's password, which is medicine, on any of those platforms. Good luck, and we'll announce the winner later this week. Now, back to the show. I want to just tell you, I love what you were talking about, the mindfulness and the mindset. As I'm wearing on my cap here, the brand is #positivity. And you have to do the intentional work to have the glass half full. So if you have a negative programming, because you live with yourself, you have negative programming, all that's going to happen, likely, statistically, is a negative result. So that applies to your own health, right? Mm-hmm. That's one of those boxes, right? So it's
absolutely.
So always start with the positive thought.
Yeah, I totally agree with you. Positive. I mean, studies have shown it. We about a decade and a half ago. It's funny. Can I bring in some religious Jewish stuff
Please.
here? I'm in synagogue back when I used to practice the traditional stuff, and one day a psychologist comes up to me while we're in synagogue, and I was in med school at the time, so maybe 20 years ago, whatever it is. I'll pretend I'm young. So last year, comes to me and he says, they just did this study, and they looked at people who believe in something higher than themselves and have a positive outlook in life live longer. This was a study. So as science has even come into that. So, I mean, my question was, what if I believe the Leafs are going to win the cup next year? Is that good enough? What is this higher being power thing you need to believe in? And what is that positivity? I mean, clearly they never win. So my whole life is miserable. No. But the idea of being positive, even that's been brought into science now. 100% agree with you.
Right. I think of how you get there, right? Oh, everything's so bad. And, people can be in that space. I'm sure you have different patients that come in with that mindset. And it's just a little shift where it's that surrender. When I see that acceptance and surrender of, why should my little ego and the I believe, and once you let that go, all possibilities open up. And it's very hard for a lot of people to get there. And
you bring in such amazing concepts. So you brought up two concepts for me right now, actually, in the idea of one, you talk about the dissolution of ego, which psychedelics do very well.
That's exactly what I was going to talk to you about the
one of the main things, like the main effects of psychedelics in general, is the dissolution of ego. But you brought up a really important point for pain patients. There was a philosopher, modern philosopher. It wasn't Nussbaum. I can't remember her name, but she was like in the last 20 years. And she came up with this amazing concept that I tell my patients all the time, something that I didn't think about, especially my pain patients. They come in and they're so attached to their pain. They can't, and it's all negative. They can't dissociate from their pain. And what I tell them is, your pain's never going to go away. I'm never going to take 100% of your pain away. I'll give you, if you want like some mind-numbing pills and live in isolation, maybe that'll help for a little bit. You have to learn to live next to your pain. And that positive mindset of living next to it, so you can walk together, so it doesn't affect you in the way that you're attached to it. That's how you get through it. And I think that comes down to exactly what you're talking about.
And I think that I know you're a big practicer and avid fan of martial arts, and I always loved the concepts of the samurai. And it's what we should achieve, is that flow state. You talk about living side by side with the pain. The pain, if you can reach that state, I think all humans have to realize that there will be pain inevitably in all people's lives. It could be pain of regret later in life, or it could be pain in things that you're dealing with, physical pain. And it's a question of what is my reaction to that physical pain. And in martial arts, we do a lot of that conscious observation of, of pain. Myself, practicing Brazilian Jiu-Jitsu for 8 years. Just tremendous. It's tremendous, great work. But I want to go back for a second. There's a big push. I have friends, family, having that conversation about plant medicine, psychedelics, and but in the context of people that are just stuck in that dark space and going off to Costa Rica, going off to wherever they're, and going on the quote unquote journey.
Yeah.
My question is, is it a material change for the better actually, and does it last? Do you see it lasting for your patients?
I started, for example, with cannabinoids. When I started 12 years ago, I opened the first clinic in Canada dedicated to evaluating patients for the use of medical cannabis, which is a plant-based medicine. Plant-based medicines there are a lot of them. There's far more than just psychedelics. And I mean, I've done 1,200, I did a survey on 1,250 patients, ethics approved, all that kind of stuff. 85% of those within the study were able to decrease their pain medicine, their opioids, by at least 50%. Of those 85%, 50% of those people were off their narcotics 100%. That was just using cannabinoids. So does it work? The answer is certainly does. And so that's the world that I come from.
Right.
When we talk about psychedelics and what is the dissolution of ego, psychedelics have they're called entheogens, right? Mm-hmm. That's the traditional term that people use for psychedelics, entheogens. The word entheogen itself, it's a Greek word. It comes from a Greek root that means generating God within. That's literally what they mean. Wow. Right. Wow. It's interesting. The first thing that comes to my mind, I go back to my religious days, but of when someone says generating God within, it reminds me of create for me a temple and I'll dwell within it. Right. Sure. Which is the concept that you somehow connect to something greater than yourself. And when you connect, and that's one of the greatest benefits of using psychedelics on its own, is that connection that you make to something grander. Anybody that, for the most part in the studies, the one thing they say is they create to something, or they connect to something grander than themselves. And that's a huge positive.
Yeah,
and
I just want to say, I think the stat was today in America, I think it was close to about 50% of people. Again, I don't talk about organized religion, but I think just as a general functionality of humans, to your point, to connect to something greater than yourself, 50% of humans in America today do not have a connection to something greater than themselves. We call it God, an energy, super being. I do believe it is important. Why? When things are good, okay, it's great, I feel great. The problem is, and like we said, pain happens to everybody, is when things are not great, right? When things are not great, where do you put the weight of that? The thing that's bigger than yourself, you're able to put that weight over and you're able to move forward. But if all the weight is on your shoulders, you can't see past that space. But I wanna also go to, emerging treatments that you're seeing right now. Is there anything that's kind of on the forefront that's exciting you, kind of clinical trials or things that you're seeing with patients? What's the most exciting things from a medicine perspective that you're seeing right now?
Yeah. So I'll tell you, for me, for the last 200 years, we've been treating cancer with chemo, radiation, and surgery. And it's been very difficult. And for the most part, you go through chemo, you may go into remission once. Some cancers it really cures, does a good job, kills you at the same time as it kills the cancer, right?
Right.
And you'll do, chemo, radiation, surgery, go back for chemo, then death, because your immune system is basically done for. And in the last, yes, we're coming on these immune modulators, and which are wondrous. I mean, clearly we're seeing these small trials come out, and the new breakthrough is dealing with immunity, which I totally agree. But I'll tell you what our company, which is making me really happy, is we're putting a very specific cannabinoid, I'll call it concoction, a formulation. It's a formulation that includes cannabinoids and specific terpenes that I've seen anecdotally work wonders on different forms of cancer. And I don't know why. I can't tell you how it's working. I can tell you maybe it's helping reset the immune system, or it's working as an immunomodulator, which explains why it would work, because it is an immunomodulator, and we're seeing immunomodulators work very well right now. So what we have to do is put the evidence behind it. So you got to do the studies. But I'm seeing anecdotally it's working great. I don't know why. So that really excites me, and I'm going to build a charity behind it, and I'm going to build like a whole plant-based cancer research movement, so that we can move on from and bridge that gap between what we've seen in the last 200 years and what's been happening for the last 10,000.
And that's the work you're doing with.
That's part of the work I'm doing with New Era.
New Era by Pharma.
Yeah. And with cannabis research. Or plant-based cannabis research for cancer and other autoimmune diseases. And but we're seeing, it's interesting because we just saw those two studies that came out recently on the immune modulators that basically took away, in the 18 patients that had a specific form of rectal cancer, they were all basically cured. The tumors disappeared.
I think that's tremendous.
It is. And there are only 18 patients in the study. It's a small study. It's a very specific form of cancer, but we haven't had any breakthroughs in cancer in 200 years. We've been doing this, and pharma raises $83 billion a year, for charities. And where have we gone? Nowhere. Right. So it's time for that change.
I know, I'm just what I hear around the world. Some people go to Germany, Switzerland, different kind of clinics around the world, or even in Tijuana, and the results. Again, I just keep going back to the results. Break through barriers of conclusions in people's mind, but to be as radically open-minded as possible, looking at those results, checking out, doing research. I'm a big advocate of, we have the internet, doing research as much as you can, to speak to people, to speak to doctors, to speak to patients, to get informed, and then everybody choosing what pathway to take. And obviously a big issue is heart disease. Are you seeing, when people come with different heart disease issues, what's kind of your protocol? What's your thinking with heart disease?
I mean, heart disease is still one of the biggest killers in the entire world. So I don't have I'm not a family practitioner. I do pain in my clinic, mostly around plant-based cannabinoids, and I actually take people off of narcotics, which is my other big passion, is dealing with this opioid crisis. But in the hospital, in the emergency department, we see heart disease every day. I see multiple heart attacks. So what I'm treating from heart disease is mostly the end stage, is when the person comes in and they have the heart attack. And I think this brings me back to my original point, where people rather take the pill than do the work. Right. If you're not willing to put in the time and the effort, and so a lot of people, I guess, don't enjoy it. I personally, like martial arts, I enjoy the process. I enjoy the work. Yeah. People are, why do you want to eat well? Why do you want to go to the gym? Why do you run? Why the hell are you jumping off a cliff with skis on you where you can die? I'm like, well, that's what makes me happy. That's where I get excited.
Living, by the way. That's
That's
what we call it.
Okay, so living, right. Yeah. So the idea of living can avoid the potential of heart disease later on, for the most part. There are genetic parts of it that may not,
right.
Because
I do believe... Right. To your point, I do believe all that fear and all that weight sitting on you every day, instead of living your full potential, eventually it could end up being physical ailments. And to your point, originally, people that have a positive mindset, they live longer, right? So
Absolutely.
right, doesn't everybody want to live longer? I would think so, right? So it's
As long as they're healthy and living
happy.
longer. I don't want to live long and be a vegetable in the bed.
I know you also worked as a coroner.
Still
do. I always wonder, like, who are the people that do that? And it's you, right?
Yeah.
Tell me about top, like, 2 major things that kind of play in your head doing that. And what have you learned from that experience?
I always go back to, there's always some cases that sort of sit in the top of your head. One of the things you have to do as a coroner is learn how to put things into a little box and dissociate yourself a little bit from what's happening before you. You learn that in medicine in general, especially in acute care. You put on that, when you go play soccer and those big balls and you hit each other, and basically a lot of that stuff has to bounce off of you. Otherwise you won't function in your daily life. You're going to investigate the death of 7 to 10 people every day who have either died of an opioid overdose or some form of neglect, or because we don't investigate natural death. We only investigate homicide, suicide, or accidental death, or undetermined, right? And so for the most part, when you get called to go into these things, it's nothing that's normal, or if there's a family issue. And so the things you see are pretty intense. Right. And obviously, there are deaths of children and neglect and opioids and narcotics. You see these things all the time. One thing you learn not to take for granted is that we are a social species. Everybody reacts to death differently. Sometimes you see families that are, outrageously upset, and some who have this great understanding of death and or recognize something different about death, and it's the cycle of life. Whether you're Hindu or whether you're Christian or Catholic or Jewish or Muslim, you have these different understandings of death. And I think what I realized from all the effort we put into organizing religion and doing all these things is to help us understand the things we don't understand. And some people call it God of the gaps. And so you realize that people just really understand life differently. And I think it puts life into perspective for me when I'm working as a coroner. Certainly, children are the worst. You go home, you kiss your kids over and over again.
Yeah, I think definitely a deep sense of gratitude for the things that you have. And I think that's kind of how I see it. And I want to just say the work that you're doing for cancer patients, for people addicted to drugs, alcohol, and everything else, and your mindset. I want to say thank you. It's really been a real pleasure. Thank you, Dr. Ira. And I want to, how could people follow you on social media? How could people be in contact with you?
I'm pretty vocal on social media at Dr.Ira Price on Instagram, Dr.IRAPRICE. I don't use Twitter very much. And now that Elon Musk owns a bunch of it, maybe I'll come back in. But I find it like a cesspool of one words. Like, it's just like, boom, what's shiny today? Anyway, so I'm there. And check out New Era Biopharma, NEAUERA biopharma.com. Those are basically the 2 best ways to get in touch with me. To be honest, I try to respond to every DM. Sometimes it takes me a long time. But if they hit me up on Instagram, follow along. Doing some really cool things. I really appreciate you having me on as well. It was a great conversation. Thank you so much.
And keep doing the good work. Thank you so much, Dr. Ira.
Thanks, sir.
Thank you.
Thanks for listening to the Common Denominator podcast. Join us next week for another inspiring, impactful, and empowering conversation. To learn more about Moshe, head to moshepopak.com. If you enjoyed this episode, feel free to share it. And we'd be grateful if you could rate, review, and subscribe to the show.